Sergio.
Thank you.
So, la salle. Welcome. Bonjour. Hello. Bonjour tout le monde. Je m'appelle Jérôme. Je suis français. J'habite à Barcelone et j'ai une sclérose en plaques depuis 4 ans, depuis le 7 janvier 2020. Et nous sommes réunis aujourd'hui dans ce bureau pour faire cette interview avec le Dr Menendez, qui est l'expert spécialiste du protocole Coimbra pour les maladies auto-immunes et dont je suis le patient. Et ça me tenait fort à cœur de pouvoir diffuser, partager ce protocole car ça marche. Donc je vais vous présenter Monsieur Menendez, Dr Sergio Menendez, good morning. Merci beaucoup d'être là. A mix of French and English. You are a doctor of Protocol Coimbra, and I would like to thank you again a lot to be there, to have accepted this interview. This interview is really important for me, probably for the French people having autoimmune disease, because you are a specialist on autoimmune disease. We are going to speak in English. You are Spanish from Cuba. You are speaking Spanish, your English is very good. Me, I'm French and I have a very strong French accent, but we are going to do our best. And be kind, please. We are in Barcelona, and the purpose of this interview is to explain what is the Coimbra Protocol. And in fact, for me, this interview is very, very important because I've been dealing with multiple sclerosis for the last 4 years. And hopefully, I met you 4 years ago, and I am one of your patients. So I want to share how much better I feel myself now, because for me, it's my experience, and so it's my testimonials because of the Coimbra Protocol. And when I met you, when you explained me all the information that I can remember the first time that we met physically, it lasted 1 hour 30 minutes. And it lasted 1 hour 30 minutes, and it was 9:30 p.m. and I asked you, okay, I got everything, I'm convinced, and I have no regret to have done it. I took some notes just to be sure that I didn't forget nothing. In fact, the purpose of this interview is more or less that you share all the information that you explain me at this moment. And I think for me it's super important to get an easy to understand information straight from a specialist on autoimmune. And everybody going through this kind of situation, so the patients and the families or friends, loved ones, need that too. So in France there is not so much information, so I hope it's going to help a lot of people. What may I say else? You are going to explain us what we must do, how the protocol Coimbra is working, and even despite the sickness, multiple sclerosis or autoimmune disease or whatever, we can expect to have a good life. And I'm here I confirm. And for something that is super important, I think, is that all of this is going to be backed up by real scientific data, because the protocol Coimbra, the Coimbra Protocol, is a real treatment, a real official treatment based on vitamin D, and we can see that there is a lot of success stories on the issue of people under treatment with the Coimbra Protocol. So, many thanks again, and may I ask you to introduce yourself?
Okay. Well, firstly, I appreciate your invitation. Well, my summary of my history is that I am Cuban. I studied medicine in Havana, in the University of Medicine of Havana. I finished my university in 1996. And after I finished, of course, I decided to move to Sao Paulo, Brazil. And I decided to move because I wanted to start with my PhD and my master's degree in neurological science. During this period, all my studies was accompanied by Dr. Coimbra. Dr. Coimbra was my professor in the Federal University of Sao Paulo during all my master's degree and PhD. After I finished my PhD in 2004, I started to work like most of the doctors. Firstly, I work like a family medicine, general practitioner, family medicine, and I work like a family medicine during almost 8 years. In 2012, Dr. Coimbra was my professor before, called me that he wanted to explain me about some protocol that he was or he created at that moment. He asked to me if I was interested in participate or accompany patient with autoimmune disease with this protocol. Of course, I received the training. I trained almost 1 month. After that, I started to accompany patients since 2012 until now. I accompanied during all of these years approximately more than 4,500 patients in the Coimbra Protocol. Well, in 2016, I decided to move to Barcelona because I have all my family here in Spain, and I decided to move to Barcelona. I am continue working with this Coimbra Protocol in my private office here in Barcelona. I start to accompany patients here in Europe. Most of the patients that I was accompanying at that moment in Brazil, some doctors of our teams continue accompanying all of these patients. But well, I think that's all. It's a summary of my history.
Big one. And you confirm 4,500 patients total?
More or less, wow. 4,500 patients, more or less.
Okay. Thanks to
all of them, of course, with autoimmune disease. I can say that approximately 50-60% of them patients with multiple sclerosis.
Maybe what we can do to get the big picture is to make this interview in 3 parts. The presentation of the protocol Coimbra Protocol, pardon. B, starting the Coimbra Protocol, and the last one is a life adjustment following the starting of Coimbra Protocol. Can you tell us exactly what is the Coimbra Protocol?
The Coimbra Protocol is a protocol that was created by a neurologist and professor of the medicine school in Sao Paulo, in Federal University of Sao Paulo, Dr. Coimbra, in 2002. Dr. Coimbra started to apply this protocol in 2002. This protocol is used to accompany patients with autoimmune disease. Since 2002, and now we accompany thousands and thousands of patients around the world. Okay, and this protocol is based on the use of higher doses of vitamin D. We use the vitamin D to try to control the evolution of autoimmune disease. That's the Coimbra Protocol.
Dr. Coimbra is a neurologist.
Yes, he's a neurologist, and he is a professor of the Federal University of Sao Paulo.
That is going to secure a lot of people. Exactly. What is an autoimmune disease exactly? What are the factors? Definition?
Our immune system defends our body from infections. Okay, when the immune cells detect or find a pathogen in our body, the immune system create some specific cells called antibodies, and these antibodies attack the pathogen or fight this pathogen to avoid the infections. Okay, usually the immune system recognize, or our immune system recognize the difference between foreign cells and our own cells. But what happens in autoimmune diseases? The immune system starts to recognize some part or region of our body like foreign and start to produce another specific kind of cells called autoantibody, and this autoantibody produce inflammations and destroy tissues in our body. Depends on the region that produce this inflammation and depends on the symptoms that the person develops, we can make the diagnosis of a specific autoimmune disease. For example, if these autoantibodies produce inflammation in the cells that produce insulin in the pancreas, okay, this person probably reduce the insulin production from the pancreas and develop diabetes type 1, is an autoimmune disease. Or if this autoantibody produce inflammation in the myelin, in the central nervous system, in brain or spine, probably this person will develop a neurological autoimmune disease, and the most common neurological autoimmune disease is multiple sclerosis. Or if produce inflammation in our joints and provoke destroying the formation in our joints, probably this person will develop rheumatoid arthritis. But exists many autoimmune diseases.
I can remember when I was diagnosed with multiple sclerosis. The doctor told me there was a list of 400, something like that, more than 400 autoimmune diseases. Is that correct?
Yes, especially in person that we suspect of multiple sclerosis. Some symptoms of some neurological symptoms caused by multiple sclerosis at the same time are similar symptoms that can cause it but another diseases, and that's why when we start to find the cause of the illness, of the symptoms of the patient, we do some specific neurological exams, but at the same time another blood test or another exams to try to conclude that these symptoms are only neurological symptoms and are only as a consequence of multiple sclerosis, or not by lupus or another disease that could provoke similar symptoms.
But lupus is an autoimmune disease?
Of course.
Okay.
Systemic erythematosus lupus is an autoimmune disease, and sometimes lupus can provoke neurological symptoms and are similar symptoms that patients with multiple sclerosis could develop.
Yeah. For all this kind of disease, so all autoimmune disease, the Coimbra Protocol is working?
Yes, this is valid. This protocol we can apply in all patients with any other autoimmune disease. Exists many autoimmune diseases. In medicine, in almost all the specialties, we find patients with autoimmune diseases. Then rheumatoid arthritis, ankylosing spondylitis, vitiligo, psoriasis, lupus, and many others diseases.
Do you have any statistic about patient outcome?
You mean the successfuls of patients with?
Yes.
Well, in this protocol, we start to apply this protocol or accompany patients with autoimmune diseases. We observe that approximately in 90% of patients that start the Coimbra Protocol, the disease entered in remission. I mean, when we said that the disease could enter in remission, we are not saying that the patient cure the disease or healing the disease. Not. It's that the disease stop this evolution, and the patient probably will not have new symptoms or new lesions, depends on the diseases. That's what I mean, that the disease entered in remission. In approximately 90% of patients or more, depends on some situation and some factors, but approximately 90% of patients the disease entered in remission.
And could you explain us, so we're using the vitamin D at a very high level of concentration. What is the specific role of the vitamin D in the treatment?
I think that before to talk about the function of vitamin D in our body, on the action of the vitamin D in our body, we need to explain to persons that is seeing this interview how Dr. Coimbra create this protocol. Okay, it's very important. In 2002, Dr. Coimbra was not very satisfied because the neurology is a specialty that used to do brilliant diagnosis. Okay, most of the neurology used to do brilliant diagnosis, but the treatment that we have are not so effective in many patients. Okay, then Dr. Coimbra was very worried because of this, and started to search information in the medical reports. What kind of substance could help patients to protect the central nervous system or to stimulate regeneration in the central nervous system? In this searching that he did, he found that vitamin D has a very important function in our body, and vitamin D stimulate in the immune system regeneration of some cells. At the same time, what he decided to do after he found this information, okay, is vitamin D could help patients to avoid neurodegeneration or to regenerate our cells. He decided to prescribe or to accompany some patients with Parkinson's disease, and he decided to prescribe 10,000 of international unit of vitamin D, a realistic doses of vitamin D. Why realistic doses? Because at that moment in 2002, most of the doctors used to prescribe no more than 600 or 800 international units of vitamin D per day for patients or for all the persons. But if we stay, for example, on the sun, our body can produce 10,000 international units of vitamin D only after a few minutes receiving staying in the sun. Of course, Dr. Coimbra, with this information, decided to prescribe to all of these patients with Parkinson's disease 10,000 international units of vitamin D. And after 2 months, one of the patients that at the same time had vitiligo, this patient had a big lesion in the taste with vitiligo. The patient said to Dr. Coimbra that this lesion reduced almost 90% in size. And of course, with this information, Dr. Coimbra cut attention. Well, I need to look information if exists a relationship between the vitamin D function and our immune system. And he started to searching information about this, and he found many important information. The first one is that many papers confirm that vitamin D deficiency is a possible risk factor to a person developing disease. At the same time, he found some information, some papers, especially in patients with multiple sclerosis, confirming that if a patient with multiple sclerosis maintain the vitamin D deficiency, probably the evolution of this patient will be worse when compared with patients that maintain normal level of vitamin D. And the third one information, and the most important, is that many papers confirm that all patients with autoimmune disease has resistance to transform the inactive vitamin D to active vitamin D. I mean, all patients with autoimmune disease have difficult to transform the vitamin D, and because of this, most of the patients cannot benefit or cannot receive the benefits of the biological use of vitamin D. Then, with this important information, he decided to prescribe to patients with multiple sclerosis that he accompanied in the office with 10,000 international units of vitamin D per day, the same than the patient with Parkinson. Similar result he found. Most of the patients start to improve many neurological symptoms after the vitamin D level increase. Dr. Coimbra thought that probably the vitamin D have a therapeutic effect in patients with autoimmune diseases, and especially in patients with multiple sclerosis. And he thought that probably if we increase more the level of vitamin D, because this resistance to transform the vitamin D, probably he could change the evolution of this disease. During 1.5 to 2 years, he increased the level of vitamin D slowly in all of these patients. What happened? More or less after 2 years, the disease entered in remission. I mean, the patients stopped having new relapses and new lesions in the MRI. Of course, to conclude this, Dr. Coimbra accompanied during many years all of these patients. As I told you before, more than 90%, 95% of these patients, the disease entered in remission. With all of this information, he created a Coimbra Protocol. In this protocol, besides to prescribe the vitamin D, patients need to follow some specific orientation about nutrition, about foods, because we know that vitamin D could be toxic for us. Yeah. That's why all patients need to follow these orientations. Okay. Yes. Your question
was about the specific role of vitamin D, why we are using.
Exactly. So exactly. How is possible that an autoimmune disease that is considered a dangerous disease, how is possible that enter in remission? Okay, vitamin D has many functions in our body, but one of the most important functions that vitamin D has in our body is that vitamin D regulates the immune system function. Okay. The vitamin D will have 3 specific actions in our body. The first one is the vitamin D will increase our defense against pathogens, like we talked before, and that's very important for us. At the same time, vitamin D will increase the immune tolerance. I mean, our immune system will be more tolerant with our body, and this is very important because we don't know why in most of the patients with autoimmune disease the immune tolerance decrease a lot. The third action is that vitamin D will block the autoimmune response. I mean, the response that provoke inflammation in our body, destroy tissues, that respond that we call Th17 response, or the interleukin release in our body that provoke inflammation, well, the vitamin D will block. Exists many papers, more than 2,000 papers, medical papers, confirming that vitamin D block this autoimmune response. And of course, if we block the autoimmune response, we stop all of this inflammation in patients with autoimmune disease, and probably this patient will stop the disease evolution and the disease will enter in remission. That's the way that vitamin D acts in our body. Okay?
We got the explanation of the why we are using of the vitamin D. You explain us the process of the evolution of the Coimbra Protocol since 2002, if I'm correct. So it's super interesting. But we know, you told me, I'm practicing every day, that there is a toxicity with the vitamin D. That is one of the side effects. Can you speak about that and to explain us why there is this toxicity and what we must do to be okay with that?
Well, besides this action or function of the vitamin D in our immune system, vitamin D has another important function in our body. I mean, vitamin D participates in the calcium metabolism. Okay? What is this? The active form of the vitamin D will join to some specific receptors in our intestine, And here in the intestine, vitamin D has another function. Vitamin D will facilitate the calcium absorption from the foods to our body. The quantity of calcium that we will absorb from the foods depends not only on the foods, of course, that contain calcium, depends especially on the level of vitamin D that we have in our body. To understand, if I increase the level of vitamin D in all patients above the normal range to block this autoimmune response, of course, in the intestine, this vitamin D will join in almost all the receptors in the intestine. And here, vitamin D will absorb almost all the calcium from the foods to our body. Okay, if the patient, following the Coimbra Protocol, continue eating or drinking foods that contain higher quantity of calcium, what will happen? The calcium could increase in our body, in the blood. When the calcium increase in our blood, our kidneys are the organs that maintain the equilibrium in our body. Our kidney detect when this calcium increase and probably will filtrate our blood to release or to eliminate all of this calcium through the urine to maintain the equilibrium in our body. Okay, if a person release continuously higher quantity of calcium through the urine, more than 2 days, 15 days, 1 month, of course, this calcium could damage our kidney, could provoke nephrocalcinosis. It's a condition where the patient probably will develop renal failure. Of course, it's not possible to treat a patient with an autoimmune disease and to provoke another big problems. Of course not. Then, how to avoid this? During the first 2 years that Dr. Coimbra started to increase slowly the vitamin D level in all of these patients with multiple sclerosis, in the meantime, he observed that some patients start to release or to eliminate higher quantity of calcium, and he asked to these patients, to stop to eat or to drink all the foods that contain higher quantity of calcium. For example, he asked to stop eating dairy products, milk, animal milk, cheese, yogurt, or the cream of milk, some dried seeds, for example, the nuts, Brazilian chestnut, pistachios, almonds, because all of these seeds contain high quantity of calcium, and other foods that patient cannot eat. And in the appointment, we explain to all patients what are the foods that they cannot eat or drink. And if the patient stop eating all of these foods, we will maintain the equilibrium of the calcium in our body. We will avoid that this calcium in the blood increase above the normal range. We will maintain the equilibrium, and we will avoid that this patient release or eliminate higher quantity of calcium through the urine, and we can use these higher doses of vitamin D to saturate the receptors in the immune system to block the autoimmune response. That's why all doctors consider that vitamin D could be toxic in higher doses, but they need to understand that when the patient start this protocol, all of these patients need to be accompanied with doctors that were training in the Coimbra Protocol, and all of these patients need to follow some orientation about nutrition, about liquids. All of these patients need to drink high quantity of liquid to avoid any kidney problem. And if the patient maintains this equilibrium, we avoid any side effects. This protocol is a protocol that, despite we use vitamin D in all patients and other supplements in all patients, we adapt this protocol to each person, to each patient, okay? It's not the same. It's not that all patients will take the same quantity of vitamin D or will do the same. No. We initiate the doses that we used to initiate in the Coimbra Protocol depends on many factors. Firstly, depend on the weight of the patient, the height of the patient. Second one, depend on for example, the disease that this patient has is not the same multiple sclerosis and this patient had a flare or a relapse 2 or 3 months ago, or this patient have optical neuritis is a symptom that provoke many limitations for patient. When compared with another diseases like psoriasis or vitiligo, despite any autoimmune disease are good, but of course exists a difference between neurological autoimmune disease or rheumatological autoimmune disease and dermatological autoimmune disease. Exists difference. Then we decided the quantity of vitamin D that the patient will start depends on all of these factors, okay? But in summary, we used to prescribe 1,000 international unit of vitamin D per kilogram per day. Okay, some patients we can initiate with 20% more, depending on their condition. Some of them 20% less, depending on their condition. But in summary, is this. Okay, before to start the Coimbra Protocol, before to start with all of these supplements patients need to take, but the most important is the vitamin D, of course, all patients need to do blood tests and urine tests. Which are the most important exams we need to analyze here? Well, the level of vitamin D, the parathormone, the PTH, the calcium in the blood, calcium in the urine of 24 hours, phosphorus, renal function, urea, creatinine, glomerular filtration are the most important. Of course, depends on the pathology, depends on the diagnosis. We used to ask to the patient to do some specific tests, but related with the Coimbra Protocol, that's the most important. And after the patient start the protocol, at least 2 months after the patient start the protocol, all patients need to repeat all the exams, okay? We will analyze how is the calcium in the blood, if it's normal or not, the calcium in the urine, the renal function, and if it's necessary to increase or to maintain or to reduce the quantity of vitamin D. Depends on the results of exams, depends on how is the patient, many factors. And we will accompany these patients during the protocol, doing frequently all of these exams. It's not, and that's why all of these patients need to be accompanied by a doctor training in the Coimbra Protocol, because despite all of doctors know about the result of these exams, but not all of them know how to accompany this specific protocol, and that's why patients need to be accompanied only by doctors in the Coimbra Protocol. It's not a possibility that any other professional that is not a doctor accompany patient, because sometimes we receive some person that are or naturopathic or nursing or physiotherapy to try to training. It's not possible. It's not that this person don't have the knowledge, the enough knowledge to accompany, but it's not possible, because in the Coimbra Protocol it's necessary to be a doctor that accompany patient with autoimmune disease in this protocol. Okay.
It's super interesting because first it's a protocol. Before I was working in aviation, protocol for me sounds like procedure, and I can see that the personalization is really you have a process and you have some different data parameters, and you are going to follow your procedures to optimize what is the best for your patients.
Yes, and not only in this, in the appointment, besides to explain to the patient how we'll accompany about all the exams he need to do, we explain to all patients how the vitamin D function in our immune system, which are the results we can expect in these patients in the disease evolution, how we can avoid any side effects about the vitamin D. Because of course it's not only to accompany with exams. In a person, for example, in any person, when increase the calcium in the blood and increase the calcium in the urine, we know that before to provoke any problem to our kidney, some symptoms could appear, and these symptoms suggest that the calcium probably is higher in the blood and higher in the urine. Most of the time, these symptoms used to appear before to provoke any problem to our kidney. And we give this information for patients, which are the symptoms that could appear if the calcium is higher, because this is important for the patient. If the patient starts to feel these symptoms, patient can stop the Coimbra Protocol, and we can ask to do some specific exam to see how is the calcium in the blood, in the urine, the renal function, and if it's necessary to stop the protocol or to adjust the vitamin D or to do something else. And that's why this protocol is not a simple treatment that I will give to the patient a medication and a patient need to take and forget. Not a treatment that the patient need to participate in this treatment, and the patient need to be responsible during all the treatment, need to follow all the orientation to avoid any problems, any renal problems.
It's a partnership between the doctor and the patient. Yeah. I know. About the symptoms with too much calcium in your blood, for instance, what kind of symptoms can we experience?
Okay, the symptoms that used to appear when the calcium increase in the blood or when the patient start to release higher quantity of calcium through the urine are thirsty. The patient is drinking higher quantity of liquid, but even drinking this continue with healthy, that is not enough the liquid that he is drinking. Or she can feel nausea, desire to vomit, constipation, stomach pain, loss of appetite, and all of these symptoms when appear suggest that the calcium could be elevated. And in this condition, we orientate to the patient, well, you need to stop the Coimbra Protocol, we need to do some exams and to analyze what to do.
We did the presentation of Coimbra Protocol, but this conclusion for this first part, in fact, we need first to contact and to follow the instruction of a doctor specialized on the Coimbra Protocol. We must change our diet, and if we do both, if we have an autoimmune disease, we have 90% chance to be in remission.
Yes.
So now maybe we can go to the next part about starting the Coimbra Protocol. For me, the meaning is about the operational, how do we contact you, all this kind of stuff. So my first question will be, after the diagnosis, the famous diagnosis, the patient knows that he has sclerosis multiple, MS, CEP in French. What should be done first?
After a person was diagnosed with an autoimmune disease, need to hear about doctors that made the diagnosis. Does he propose to do the treatment that he proposed to follow? After the doctor explained the treatment that he proposed to follow, I think that patients need to look information about, well, what else I can do or can I do to try to stop this disease or to try to reduce the consequence of this disease. And in the case of the Coimbra Protocol, we suggest to all patients that want to start that firstly look information or search information about what is the Coimbra Protocol, how it functions, if the Coimbra Protocol has side effects or not, and how can we avoid these side effects on the case of the Coimbra Protocol. If it's possible for me to follow this protocol or not. I think that exists many information on internet, many web page, many social media, that many patients that joined in social groups on internet are talking about the Coimbra Protocol, their experience in the Coimbra Protocol. After that, at the end, decided if he want to start the Coimbra Protocol or not. I think so.
If somebody decide to take the option of Coimbra Protocol, how can he get in touch with a doctor of the Coimbra Protocol, maybe with you? What is your advice about that?
Well, around the world exists many doctors that was training by Dr. Coimbra or was training by another doctors in the Coimbra Protocol. All of them are able to accompany patients with the Coimbra Protocol. In my case, I am working here in Barcelona in a private office. I have my web page. Patient can, or in my web page, or the patient have all the information how to send to me an email or to contact by WhatsApp. In the case of the other doctors, I know that exists a page in Google Maps where you can find the list of almost all the doctors following the Coimbra Protocol around the world. In these maps, you can find specific information of all of them. Exists many of them in Brazil.
We will give the link because, for instance, in France, there is a website. I don't remember the name of the person. It's www.protocolinfo.com. You have the same one in English. It's an American one. In Italy, it's a Facebook page, if I'm correct. But now, let's say that for the French public, you have all the information. It's super well designed, super well done, and in fact, it's the one that I use to find you. So, and you have all the phone number on the list, all these things.
All of this training started in Brazil, in Sao Paulo, with Dr. Coimbra, in the Dr. Coimbra office. And of course, many doctors, Brazilian doctors, training in the Coimbra Protocol. I think that exists more than 40, 50 doctors or more of them. I don't know exactly the number of doctors in Brazil that accompany the Coimbra Protocol. But of course, after 2014, 13, some doctors, especially from Europe, firstly from Italy, after that from Germany, and other countries here in Europe, training in the Coimbra Protocol. Then exists many countries here in Europe, doctors that accompany patients with the Coimbra Protocol. In the States as well, in some Arabic countries as well. Well, all of this information patients can find in the website.
In fact, you have a lot of choice, except in France.
We know.
This is the truth. It's the reality. It's crazy, but this is the reality. So it's why, for me, it was so important to make this interview with you.
But patients in France, cannot follow with any doctor in France, but have the possibility to contact doctors from other countries, because they can do an appointment or in person or online appointment. We have this possibility now with all of this information. We have the possibility to do online appointment. Okay, it's a little different when you do the appointment in person with the patient, okay, but it's possible to do online, because some patients, for some patients, it's not possible to travel or to be in person, okay, but it's possible to do online.
If someone decides to start the Coimbra Protocol, how long does it usually last? I know the answer, but...
Well, as we talked before, autoimmune disease are chronic and most of the time degenerative disease. The autoimmune disease are uncured autoimmune disease. Then most of the patients with autoimmune disease need to accompany almost all their life doing treatments, one treatment or another one. because we cannot heal the disease. We can try to reduce the autoimmune activity or to stop the autoimmune activity to avoid that this patient develops new symptoms or new lesions, whatever. But most of the time, patients need to do treatment continuously. Okay, depends on patients, and especially because autoimmune disease are a multifactorial disease. I mean, autoimmune disease depends on many factors, risk factors. Depends on patients. Some patients need to maintain this higher dose of vitamin D during many years, and some of them we can reduce the level of vitamin D. And I can say that we are accompanying some patients that follow the Coimbra Protocol with higher doses during 5, 6, 7 years. We decided to reduce the level of vitamin D slowly after that. Some of them are taking only 10,000 international units of vitamin D in the last 7 years, 5 years. And this patient didn't have any new, for example, a patient with multiple sclerosis didn't have any new relapse or any new flares or any new lesions in the MRI, because we accompany this patient every year with all of these exams, the evolution, and this patient maintaining, taking only 10,000 international units of vitamin D. This is a condition that all patients will follow? No. Not all of them, because as a multifactorial disease depends on many other factors, and some patients with autoimmune disease maintain emotional disturbance or higher level of stress all the time. Of course, a stressful situation is considered like a dangerous situation for us, and our immune system was created to defend our body in this dangerous situation. Then in this higher level of stress, the cortisol is one of the most important stressful hormone, stimulate our immune system to try to defend our body. But when stimulate the immune system, could stimulate the autoimmune response. Then some patients, even controlling the disease, maintaining higher level of stress, and we know that if this patient stop the vitamin D, probably this patient will have new flares or new lesion, new symptoms, and that's why we suggest to this patient to continue the protocol to maintain the control of the immune system.
So what about, let's imagine that there's a case of somebody is under a conventional treatment for multiple sclerosis or another autoimmune disease. Can he start the Coimbra Protocol? Is there?
Of course. Any patient that is following any conventional medication with immunomodulator medication, immunosuppressor, can start the Coimbra Protocol at the same time. We never ask to any patient to stop the medication. It's possible to the patient start and to follow both treatment. And not only the conventional treatment. We know many patients that follow any other natural treatment. It's possible. If the treatment will not interfere in the calcium metabolism, the patient can continue doing without any problem.
If somebody is contacting you and she's under a conventional treatment, there is a neurologist initially following her, and maybe we'll like to know more about the Coimbra Protocol. Maybe we'll have question when he's going to hear what you are maybe starting another treatment or something like that. You know, it's a both way communication. Let's say that if a doctor is willing to get some information about the Coimbra Protocol, or maybe is interesting and is willing, that you are professional guys, so is willing to get real information, not a YouTube video, but what he should do. Is there some certification, training, as you did? You told. Can you speak about that?
Well, I think that if a doctor is interested to be training in the Coimbra Protocol, the first thing that this doctor needs to do is to search information about the function of vitamin D in the immune system, how vitamin D acts in our body, how it's possible that the vitamin D could control or to block the autoimmune response. Of course, to search information about medical reports or medical papers about the Coimbra Protocol. Exist some papers that was publishing since 2012 until now, some papers in the Coimbra Protocol. The first one with using real higher doses of vitamin D was published by Dr. Coimbra, accompanied patients in the Federal University of Sao Paulo in the medical school, accompanied patients with psoriasis and vitiligo using higher doses of vitamin D. This paper shown that we can reduce the lesions and we can control better these diseases in patients. Exist another papers, for example, one of them was published in 2022 related the safety of this protocol. In this study, they accompany more than 300 patients with autoimmune diseases, different autoimmune diseases, and all of these patients were following the Coimbra Protocol. They accompanied during 3.5 years approximately. And the objective of this paper, of this study, was to prove that it's a safe protocol, because in this study they accompany a patient with the renal function, I mean the level of urea, creatinine, glomerular filtration, the level of calcium in the blood, the level of calcium in the urine, the level of vitamin D, the level of parathormone. At the end, this study confirmed that it's a safe protocol if patients follow all the orientations that need to follow about food restriction, about liquids is necessary to drink. Then I think that with all of this information that and other papers that were publishing in the Coimbra Protocol, if the doctor wants to be training, need to enter in contact with doctors that were training in the Coimbra Protocol to receive this training, because it's not only at the beginning only Dr. Coimbra made this training, but we know that exists many other doctors around the world that are training patients in the Coimbra Protocol. In my case, I used to train some doctors in the Coimbra Protocol. Depends on the region, but they can enter in contact with us.
Maybe we can attach some official study of the vitamin D, the studies that you were talking about, in the website or whatever.
Yes.
Yeah?
Yes.
Excellent. About money, budget, what, I know the answer, but what is, in your opinion, what is the budget per month is going to cost to your patient? I'm not talking about the consultation, but about the vitamin D or anyway.
Well, depends on many factors, but we will talk about the treatment cost, not about the appointment or whatever, because depends on many regions, the doctors, depend on many factors. But the most important supplements in the Coimbra Protocol is the vitamin D, okay? We accompany many patients that they are not able to buy all the supplements and only take the vitamin D, and the result is similar than the others. Okay, then the vitamin D is cheaper. It's not you can buy vitamin D in many websites specialized in supplement. Exists many brands of vitamin D that we can trust in this vitamin D. In summary, the cost of the treatment by month is around 50 euros or less than 50 euros by month. Depends on what kind of supplement the patient is taking, okay? But more or less this.
For my case, my personal experience, okay, now it's 50,000, but each pill is 10,000 international units. I think you have 260 pills, so I think it's less than 12 euros per month, maximum.
Yes, only the vitamin D. I'm talking vitamin not D, only. Yeah. I'm talking. Discussing is not only the vitamin D with the other supplement, but only the vitamin D by month is more or less this.
It's very accessible. It's a very low budget. That is my experience.
Exactly.
Something that's really important is the life after starting the Coimbra Protocol. Life meaning about, we spoke just before about the stress. I think it's the main risk factors to avoid to get a relapse, or an attack. And there is a life adjustment about lifestyle. Can you first start to tell us what are the main risk factors for autoimmune disease?
Autoimmune disease, as we talked before, is a multifactorial disease. Then exist many risk factors that increase the probability to a person to develop an autoimmune disease. I think that the most important risk factors, and exist many medical reports confirming that, is the vitamin D deficiency. Of course, the vitamin D, as we talk about this, the vitamin D has the function to regulate the immune system. And if we maintain the vitamin D deficiency, we will increase the probability to upregulate the immune system and to develop an autoimmune disease. But of course, it's not the cause of the autoimmune diseases, it's a risk factor. Another risk factors that participate in this process is the family history of any autoimmune disease. Despite autoimmune disease are not hereditary disease, we know that autoimmune disease have a genetical component. I mean, when I have a family history of somebody in my family have an autoimmune disease, the probability that I have to develop an autoimmune disease is higher when compared with another person that don't have any family history of autoimmune disease. Another risk factor is the emotional factor. I mean the stressful situation, okay, especially the stressful situation. We know that a stressful situation are dangerous situation for us, and we talked about this minutes before, that this stressful situation could stimulate negative our immune system, could stimulate our autoimmune response, increase the probability to provoke inflammation in our tissues. Exists another risk factors. For example, we know that exists some virus that could increase this probability to develop an autoimmune disease. For example, the Epstein-Barr, the cytomegalovirus, or any other virus. We know that are not the cause of the autoimmune disease, but increase the probability to a person to develop an autoimmune disease. Another risk factors is about microbiome in our intestine. For example, we know that persons who have increase of permeability, we know this term like leaky gut, this person have higher probability to develop an autoimmune disease. If I have many of these risk factors, of course, I will increase more and more the probability to develop an autoimmune disease.
On the opposite side, what must be done by the patient to avoid this risk of these risk factors?
We can change some of these risk factors. The genetic point is not possible to change. Until now, it's not possible to change. But, okay, we need to avoid, like a person that have family history of autoimmune disease, I need to avoid the vitamin D deficiency. Then I need to, or to take vitamin D after the orientation of a doctor. We need to take vitamin D to avoid, to maintain this vitamin D deficiency, and realistic doses of vitamin D. That's why we suggest to all persons that want to avoid this vitamin D deficiency to look information with doctors that know how to prescribe the correct doses of vitamin D. At the same time, we need to change, or we need to manage better our problems during our days to try to maintain the level of stress as lower as possible. Okay, it's not avoiding problem. It's impossible to do that. How can I do to try to manage better my problems and to avoid this stressful situation? Well, I can do physical activity, I can do yoga, meditation, mindfulness, therapies. Exist many techniques. And depends on the person. Some person it's better to follow one technique or another technique, depends on the person. But I think that the most important is to follow healthy nutrition, to do physical activity, to avoid the vitamin D deficiency, and to manage better our problems during the day to avoid a stressful situation. With this, I think that we can reduce a lot the probability to develop an autoimmune disease. Okay? It's
a bit common sense, and I will suggest to add rest, real rest. It's not sleeping only,
exactly.
It's resting.
Exactly, it's important,
and,
of course.
And for you, physical activity, does it mean sport? It can be something else?
No,
it
physical
can be both?
activity in general, not only a sport. We are walking, we are doing physical activity, but
yes.
not the daily walking. We need to go out to walk with objectives to do some physical activity.
Some things that maybe can be very important to keep hope. Can you tell us some successful stories of Coimbra Protocol, some anecdotes?
It's not only a successful history, because of course I accompany many patients, and many of them, or most of them, were under control. I think that I have a history that impacted me a lot. When I started in 2012 working with Dr. Coimbra in the private office, I accompanied the first teenager patient with multiple sclerosis. This patient had, before to start the protocol, had to flare up in a short period of time. I mean, two relapses in a short period of time. And when he arrived in the first appointment, he and their parents, mother and father, were very afraid, very worried about the future, with any hopes, all of this situation that patients with not only autoimmune disease, but patients with chronic dangerous disease experience after the appointment. Of course, after we explained everything about the Coimbra Protocol and how we will accompany, and the probability that this patient has to develop another relapse or another flare, that after the protocol probably will be very low, all of them will be more calm and more confident. Well, this patient, of course, now I think that has 27, 28, 29 years old. This is an engineering, never more had any new relapse or any new flare or any new lesion, and continue, because almost all the neurological symptoms that he had in the first appointment, unbalance, numbness sensation, weakness, motor symptoms, almost all of the symptoms improve almost 100% and continue here their normal life without any problem. For me was very impact a lot to me this history, of course. When I saw this patient, I imagined my sons in a similar situation, like a father, and of course it was great for me.
So in less than 12 years, more or less, how many years?
This patient is in the protocol 14 years.
14 years?
14 years.
Yeah.
Never more, any problem.
Sergio, we are reaching the end of this interview. Can you give us maybe your conclusion, message of hope, or practical advice?
I want to give an important advice, an important message for all patients with autoimmune disease, is that they need to trust that exists another possibility, another treatment that could change all of this situation, change the evolutions of the disease, and it's possible to stop the disease evolution, the autoimmune disease, and it's possible to improve. Of course, that improvement depends on many other factors, not only in the protocol, but it's possible to change, and is a signal of hope for all patients with autoimmune disease. I think that's the most important.
Excellent. Sergio, many thanks again.
Thanks to you to invite me.
Thanks to be here with us to explain for the French people. You
Okay.
are going to receive many calls, I hope.
Okay, thank you.